and really leading from the front in terms of the African response to this pandemic. So thank you very, very much to Commissioner El Fadil, the Commissioner of Social Affairs at the African Union Commission. Thank you to Dr. Abdul Kamara, the Ethiopia Country Manager of the African Development Bank, and to Dr. John Nkengasong of the Africa CDC.
Looking for different means of financing the vaccines for Africa. We want to make sure that Africa will not be left behind if a vaccine is finally developed and approved. I would like also to thank Abdul for what he said, and we are in full agreement with the information he mentioned, that the way we will use this fund. But I would like to stress in his presence that we would like things to be done very, very fast. We don't want to wait for these funds. Abdul, we know there is certain procedures we have to follow. We will follow the procedure, but we would like it to be given a priority and these funds to come physically to the accounts of the Africa CDC as soon as possible. That's what we want, and we are sure that you will be doing so. You mentioned it, but I'm just stressing it further. But we will definitely use these funds for its purposes on the agreed terms of this agreement, and also we will be together from now till we spend the last penny of this donation. It will be spent to the purpose, and it will be serving its objectives. Thank you very much again, Winnie. Thank you to Abdul, and thank you to Dr. John and all the participants in this very important event. Thank you, and back to you.
Thank you, Commissioner. I now hand over the floor to Dr. John Nkengasong, the Director of the Africa CDC, for the closing remarks.
Thank you, Winnie. Commissioner Mira, as always, thank you for all the strong leadership and kind words to the Africa Centers for Disease Control and Prevention. Thank you, Dr. Kamara. Please extend our sincere in strengthening the Africa CDC. I recall at a summit in February 2017, on a panel discussion with Dr. Tedros and Commissioner Mira, he was the first to begin to question why the establishment of Africa CDC was that slow. I remember vividly. And he used his own example of malaria and to weaponize that discussion. So I'm very pleased to see that it wasn't just rhetoric on the podium, but that he really meant what he said. As a continent, we find ourselves at a crossroad. What we always were concerned with, that disease threats were going to undermine our development, is finally here today. And we now know that clearly. You don't need any science on the continent to show that this threat is a threat to the economy, and it's a threat to our welfare, and it's a threat to our development. Clearly, for the last 10 months, the continent has been thrown upside down, and I think the African Development Bank, as the chief developer of our continent, is a witness to that. Please, Dr. Kamara, that you touch on the key things that are emerging from this pandemic. One is the need for us to manufacture diagnostics and vaccines locally. And President Adesina has been a champion of this. I think he convened a meeting himself where he brought a manufacturer in Nigeria to discuss that. And Africa CDC will be a partner in that and continue to be very supportive. You touch on workforce development and the need to strengthen regional collaborating centers and national public health institutes. Those are all elements that we believe strongly that will be the ingredients that will guide our continental free trade agreement as we develop it, and will guide the development of the continent, both in terms of the health and economy. There is absolutely no doubt today that strengthening our health systems is an investment. It's an economic investment. And if it was in doubt a few months ago, it is crystal clear that it is today. So we will continue to work with that. In the spirit of that, to move this conversation forward today and the coming weeks, the African Development Bank, the Afri-Exim Bank, and the Africa CDC will be having a brainstorming session on how do we coordinate efforts to continue to strengthen our healthcare system. So I thank you very sincerely and look forward to a speedy implementation, and not just from the ADB, but from also counting on Commissioner Amira to work the magic within the House so that when the money comes, we can roll it out very quickly. Yes. Thank you.
Thank you very much, Dr. John. Thank you very much, Her Excellency Commissioner Amira El Fadil, the Commissioner for Social Affairs at the African Union Commission. And thank you very much to Dr. Kamara, the country representative for the African Development Bank in Ethiopia. We have just witnessed the signing of a very important MOU. We've also received updates and questions to the situation of COVID-19 in Africa. So with that, we come to the end of our briefing. I thank you very much.
Mr. Abdul, he wants just to give a few comments, please.
Please go ahead, Mr. Abdul.
Yeah, thank you very much, Chair, for giving me this opportunity again. I just wanted to acknowledge the remarks of the Commissioner, but also the remarks of my colleague John. First, from the Commissioner to continue to ensure that the second wave that is on edge, that the bank, ensures that that is also taken into consideration, so that this is not just a one-off, but more importantly, we are in this together. So I just wanted to acknowledge that. I will take this message back. The Commissioner also indicated that, and of course, building on what Dr. John had earlier said, that the vaccines are coming. Yes, we still need clarity, but more importantly, the continent will need to be strengthened for acquisition of those vaccines to ensure that we are not left behind, to ensure that the continent benefits. I've also taken note of that, and I'll pass the message. And your third message was on the funds, to make sure that they are disbursed very, very fast. I would like to assure you that Dr. John's team and mine, with the personal, monitoring and supervision of both of us day to day, that these funds will come on time. Because at the end of the day, if the funds delay, we might miss out, on the real opportunity of achieving impact. And Dr. John, as you rightly said, that the COVID-19 threat cannot be overemphasized. That is why the Africa Development Bank going forward, the high fives are going to continue to be relevant, no question. Light up and power Africa, feed Africa, industrialize Africa, integrate, improve the quality of life, but now with special emphasis on infrastructure, meaning not only economic and social infrastructure, but healthcare infrastructure. Because what this pandemic has revealed is a serious and unacceptable weakness in the healthcare infrastructure of Africa. So that is now reprioritized in the programming of all countries. I just wanted to give those small remarks and to acknowledge, that those last messages from you are taken on board, and I will take it back to headquarters. I thank you very much. And thank you so much, Wayne, for giving me this opportunity.
Thank you, Dr. Abdul Kamara, the Ethiopia Country Manager for the African Development Bank. And thank you for informing us that health infrastructure has now been prioritized in your action plans at the African Development Bank. Thank you again to Her Excellency Commissioner Amira El Fadil. Thank you very much to Dr. John. Thank you very much to colleagues who have stayed with us for the past hour and for your usual support as we talk about the COVID-19 situation in our continent of Africa. Thank you to everyone in the studio who made this possible. Let us meet again next week on Thursday at the same time. Bye-bye.